All right, good morning, everyone. I just wanted to say thank you for joining. My name, like Jacob just said, is Josh Ben. I'm the Director of Employee Benefits Contracts for the state of Colorado, and I work for DPA. What that means is I'm basically in charge of the medical contracts, the solicitation, the contracting process, and then the administration of the contracts. I actually worked on the first Paladina contract back in 2015. And I worked on this one also, the 2020 version. Paladina provides direct primary care, which is something that my doctor told me about in maybe 2010 before I even worked for the state. He was telling me about this new model of care that doctors provide, and I was kind of blown away by it. And I'd never really thought about the amount of time that your physician spends with you. But he said that on average, he had to see, I think, 4 or 5 patients an hour, and he had to chart for all of those patients, which left him 10 minutes or so in the room. And I'd never really considered that. And he said that the direct primary care model let him spend much more time with patients. After 2015, when the state got the contract with Paladina, I went over to the clinic in Capitol Hill because it was right by my office, and I wanted to see what it was about. And I was very pleasantly surprised at what the experience was like. We spent a lot of time, the physician and I spent a lot of time talking. She just kind of got to know me as a person. And then after that, when I went in, it wasn't like talking to a friend, but it was like talking to someone who knew me and understood me as a whole person. So that's really what Paladina does. And they offer just a very different experience. I'm super excited about Paladina opening up in Greeley. This was part of the contracting process for 2020. And I'm excited about Greeley for a couple of reasons. One, I was born in Greeley. Two, my earliest memories are from Greeley. I went to undergrad there, go Bears. And I'm excited about getting some care into areas that don't necessarily always see a lot of attention. And having lived in Greeley, I certainly know that can be the case out there. So I guess I'm here to say I would really encourage people to check out Paladina. The direct primary care model is just, it's an unbelievably different way to get care. And sorry, my cat is poking at my chair. I'm glad that'll be part of the video forever. It's a different way to get care, and it's a very different model. In general, they can get you in very quickly, and it's for anything from, I've had stitches removed there, to a flu shot, to a flu test, to prescriptions or anything like that. And a lot of them they could fill on the spot. So the last thing that I'll mention is that if you have a copay plan, it's at no charge. And if you have a high deductible plan, the office visit fee is only $40 if you haven't met your deductible. Which, if you look around at other places, it's so much less expensive, and the care that you get is just very different, and in my opinion, much better. So, with that, I will pass it back to you.
Fantastic. Well, thanks, Josh, and I'll introduce myself. My name is Jacob Bregman, and I lead Paladina Health's operations in Colorado. I'm going to try and share my screen and just share a couple more details following what Josh just shared about his experiences with Paladina Health. Can you see that? Or are you seeing the presentation, or are you seeing a different screen?
I can see it.
Okay, fantastic. So couple of things to point out about Paladina Health, and I should say, like Josh, I'm a proud Paladina Health patient. I actually had my physical this morning, so it's very fresh on my mind. I did a virtual physical, which we are able to do if that's convenient for you. And I'll be taking my 4-month-old daughter into Paladina for her visit next week, so I can speak firsthand about Paladina Health. So just a quick picture, our clinics, you'll see our waiting rooms tend to be very small because members don't spend a lot of time waiting in them. You typically are in and back to the exam room within minutes. And we do a lot longer appointment times than you're probably used to, as Josh alluded to. So we like to talk about direct primary care advanced primary care, and innovative primary care. So what you'll experience at your Paladina Health office is probably pretty different than any other PCP you've had before. As we've talked about, we're known for longer appointment times. If you're sick, you can typically get in the same or next day. And you know what? If something is urgent and is happening after hours, we'll give you a phone number to call so that you can reach your provider and you can get help without hopefully going to urgent care or the emergency department. We're here for you. As Josh mentioned, the copays are either none or very low. We have lots of virtual care. We can consult with specialists right from our clinic. So in some cases, we may be able to avoid a referral and take care of you directly, saving you that convenience and cost right there. And then we'll take care of your blood draws and many of the medications right in our office. In addition to being an innovative primary care provider, part of that is being a comprehensive primary care provider. So when I started using Paladina Health, it took me some time to realize the scope of services that I could have done within primary care. So I won't read through all of these, but a couple things that might be good to know is, I'll speak for myself, I have a family history of skin cancer. So I'm used to going to the dermatologist every year for an annual skin check. Well, that can be done for free or with a small copay at Paladina Health. We'll take care of women's health. We'll see kids. We can do your sports and camp and after school physicals. So there's a lot we can do, and we hope you'll use this great new clinic. We are in the process of rolling out a new set of technology tools. So you see these within the next couple of months. It's a cutting edge app that you can use to message with your care team, to initiate a virtual visit, to request a refill, and many other tasks. And then I will just end before turning over to our nurse practitioner, Michelle Rensel, by reading a quote. So you've heard Josh and me talk about Paladina Health, but better probably to hear it from a state employee who used one of our clinics over the summer. And she says, "I was skeptical, but my son who goes there told me to give him a try. They took time to know not only my symptoms, but me as an individual and hear what I was looking for in healthcare. From the first contact on the phone to my actual appointment, all I can do is praise them for a job well done. This is how medicine should be." And with that, I will turn it over to Michelle.
Hi, can you guys hear me? Yeah, thanks. So hello, everyone. Thank you again for joining us today, and also for giving me the opportunity to introduce myself. My name is Michelle Rensel. I am a family nurse practitioner. I'm in my 7th year, just for a little background, in my 7th year of my family medicine practice. And before that, I was an acute care nurse for 10 years, working mostly in hospitals and departments like the ICU and the ER, urgent care, and some gastroenterology or GI. I feel truly blessed to have had so many experiences in healthcare, and even throughout my career as a nurse practitioner, I've had the privilege to practice in different settings, from the very urban clinics to the very rural, underserved clinics, as well as some specialty. These experiences really helped me broaden my understanding of our healthcare system. It also helped me identify the things that work really well in our healthcare system, and then also the things that don't work as well. And it became increasingly more and more evident to me that the key was really health maintenance and disease prevention. Most recently, I was practicing in the state of Oregon in a direct primary care model. And this model, our model, really spoke to me. It really reminded me why I went into medicine. I was here to help people. With all the 2020 craziness, unfortunately, my husband and I decided to move back to Colorado, and we're here in Greeley to be closer to family, and we're super excited to be here and to meet all of you. Really, I'm here talking today to give you the opportunity to get to know me a little bit better. And I think it's important really to know someone's why or understand their why. And some people have asked me, well, why nursing or why healthcare? Well, you know, my passion for health really started when a loved one of mine was sick. They were diagnosed with diabetes. And before this, as a family, we rarely saw the doctor. Healthcare access was really pretty minimal for us. And overnight, you know, my family was thrust into this scary healthcare system. And that was life-changing for my family, as you can imagine. But with the help of, I'll never forget, the help of the nurses and the doctors and the health educators, we felt supported and we made it through. And that is where I found my calling and my why. And since then, it's been a passion of mine to continue helping people with diabetes, other chronic health conditions, but really helping people navigate their health in general, which can be difficult and confusing. Equally, really even more important, I like to say that I'm in the business of health and disease prevention. So often I feel like our health system, we focus a lot on sick care in this kind of more reactive approach to healthcare versus a more proactive approach. But the good news is that we know that if we can keep people healthy, we'll see better outcomes in the long run. So that really is my goal. I love what I do. I enjoy meeting new people every day. I love to get to know my patients and their families. And really my philosophy is to meet my patients where they are with their health goals and really helping them play an active role in meeting those goals. I'm huge on educating and really giving people the tools that they need to be healthy and to stay healthy. But at the end of the day, I want to provide more access to quality care, and I want to be an advocate for you. I want to be your advocate. And then for fun, because fun is important too, I love being outside. My husband and our dog Honey and I, we raft and we kayak, we mountain bike and we hike, and we love to camp. And I can spend all day talking to you about our adventures and really the adventures we want to continue having. But enough about me. I'll talk a little bit about the Greeley location. Brittany and I, and you'll get to see Brittany here in a second, we're really excited to have opened our doors here at the Paladina Health Greeley Clinic. And we really, really look forward to seeing you here. Like Jacob was saying, we're open for in-person visits, virtual and phone visits, whatever is more convenient for you guys. We are currently in our temporary space, but we expect to be in our permanent space sometime in December. We provide full service primary care, much, the things that Jacob already kind of went over, but we do physicals, really making sure that you're up to date on your preventative care things so that we keep you away from that, kind of later issues and disease. But we also do manage chronic health issues, so things like diabetes and high blood pressure, high cholesterol, thyroid disease, things like that. We do manage acute needs and urgent care as well. And as mentioned, we try to get you in same day or next day. We do see all ages, and we absolutely love seeing our pediatric patients for their wellness exams, and also for when they do get sick, our pediatric sick visits. We are extremely excited to provide those women's health services that Jacob mentioned. Just as an example, we do pap smears and family planning, which includes IUD insertions and removals, Nexplanon insertion and removals, other birth control and counseling in general. We do, or are equipped to do most urgent care, primary care procedures, skin procedures, skin tag removals, molar removals, things like that. As Jacob mentioned, we do our labs on site. And then as a part of your Paladina membership, you get basic screening labs looking at things that look at cholesterol and blood sugars, so that we can try to really get ahead of things before they become an issue. We do also provide most major immunizations for you and your family. And then we do have that small pharmacy on site. So for example, if you came in and you had an infection, we can provide you, the course of antibiotics instead of having you go to the pharmacy. Or if we're prescribing a new blood pressure medication, we can give you the first 30 days on site. And what else? I am also bilingual, so se habla español. But most of all, I just wanted to say hi to everyone and thank you again. We have plenty of availability. Give us a call or log onto your portal to schedule an appointment. We really look forward to hearing from all of you and getting to know each and every one of you and welcoming you to our practice. Thank you guys again for letting me chat today.
Wonderful, thank you, Michelle. And at this point, we would love to pass the microphone to Brittany, who is our wonderful medical assistant, who will introduce herself and tell you more about how you can schedule your first appointment.
Hi, everybody. My name is Brittany. I have been a medical assistant for about 11 years. I'm excited to start with Paladina opening our doors. Greeley is an amazing community, and I have worked in the community in many other organizations. So excited to provide this direct primary care to Greeley. If you're not familiar with Greeley, we are on the corner of 35th Avenue and 16th Street. So we are in the Bittersweet Square, kind of catty corner to Bittersweet Park. So as Michelle mentioned, we are in our temporary site right now and hope to be in our permanent location in December. We provide a lot of services. We have open availability. So if you just would like to call the clinic or schedule on the portal, if you don't have our phone number is 303-209-6371. We are here for any questions that you have. If you want to go over more of what Paladina has to offer, what we can offer, if you have any questions, give us a call and we'll definitely take care of any needs that you have.
Wonderful. Well, thank you, Brittany. I'm sure your phones will start ringing after this call. And as Brittany mentioned, if you didn't jot down the first time, the clinic phone number is 303-209-6371. You can also always find that by logging on to our website, paladinahealth.com. There's a section called Locations where you can find Greeley very easily. And then you've heard mention of the Paladina Health portal, which is my.paladinahealth.com. You can log in there and you can get yourself scheduled looking at the most convenient time that's available to you. And so with that, we wanted to leave you with some valuable health tips. So I will hand it back over to Michelle to close us out with some pearls of wisdom you can take home following today's call.
Okay, thank you, Jacob. Let me try to share my screen here. Share screen. I've never had to share my screen so much as much as this year, 2020. All right, are you guys seeing my screen right now?
Yes, we are.
Thank you. All right. So to conclude today, I figured we would talk a health tip, and with the holidays fast approaching, which is crazy, many of us really struggle to stay on track with our nutrition while also, still enjoying our favorite holiday treats. So I'm here to tell you, you can have both. So this year, I want you to focus on not only enjoying time with your families safely, but also focusing on enjoying the things that we love about the holidays, especially the food. What we do want to watch out for is really overeating during the holidays, which I know can be tricky. If you're anything like my husband, God bless him, you get your stretchy pants ready for those holiday meals and you starve all day to prepare for the food fest ahead. And it's all good until the fullness and the lethargy sets in, and the dreaded holiday pounds along with it. So how do we avoid overeating? First things first, I always tell everyone, slow down and listen to your body. I will show you in this presentation some general portion sizes to keep in mind, but really your body will tell you when it's had enough. And it's not about deprivation, it really is about moderation. So here's some tips. First, like I said, don't go to the table starving. I know it seems like a good plan to reduce all those calories in anticipation of the feast ahead, but we tend to eat more this way. I advise to stay on your regular eating schedule, really as much as you can throughout the day, so that your body will trust that you'll provide what it needs when it needs it. If you starve all day and then you eat a really large meal, your body thinks, hey, I'm gonna store this for later, just in case. And unfortunately, it stores it as fat, and that fat is really difficult to get rid of later. 2, give yourself permission to eat the foods that you like. You are allowed to eat what you like, just don't eat to the point of feeling sick. Really, eat slowly. Like I said, take your time. Try to appreciate each flavor and texture. So if you stop to appreciate the textures, or maybe even try to identify like, hey, this flavor in it, I taste this flavor in this dish. You really give your body that time it needs to process so that you can then, stop when you're full. It's really important that you stay hydrated. Try to drink water. Try to avoid the added calories of the sugary drinks and the hidden calories in the alcoholic drinks. If you need a little something, you can add some lime or lemon to your water to give it a little bit more flavor and make it a little bit more interesting. And lastly, if you feel so compelled to go back for seconds, remind yourself that leftovers are great. You can have it again tomorrow and probably the next day, but leftovers actually make it really nice. It makes meal prepping for the next week after the holiday really easy, which actually helps us stay on track with our nutrition. So if you focus on those things, you'll likely avoid overeating. So you don't have to be super familiar with, what a portion size of mashed potatoes looks like, but it is helpful to have some visual cues. I love this. This is called MyPlate, and you can find it online, myplate.org. It really helps you kind of just have a visual cue of what your plate should look like. This is about a 10-inch plate, so a regular size plate, and half of that plate you want to try to stick to kind of those non-starchy vegetables. That really should be the majority of your plate. Limiting the fats, making sure that, if you are going to have some fats, try to make it more of the healthy fats. Limiting the carbohydrates. And then the next biggest portion would be your lean protein. Thankfully, Thanksgiving's coming up and turkey's pretty lean, so that's helpful. But it's really about using your visual cues and making a plan. This is also from myplate.org. It kind of just gives you some examples of what might fall under a non-starchy vegetable. Those things, that are like the spinach and the kale and the green beans and things like that. Healthy fats might include, low-fat dairy or avocado, seeds and nuts and things like that. But really, I want you, when you go to the table and you look around, I want you to make a plan. I want you to visualize that plate first. This is a nice little picture because, Thanksgiving's coming up, and so what is my plate going to look like? Really trying to make the focal point of your plate be that vegetable. But notice, there is some carbohydrate on there. You can have your roll and your mashed potatoes, rice or quinoa or whatever it is that you like, but really trying to keep your portions, to a more moderate size. But really making a plan before you fill your plate is really the key. And then I use this all the time. It's really nice to have those visual cues. You know, the palm of your hand being about 3 to 4 ounces of a protein serving, so of your turkey or your meat in general. What I want you to notice mostly on this screen, and really just in general, is we're not saying you can't have your mashed potatoes and your pumpkin pie. I want you to have those things. You just have to watch how much you're having in a sitting. And then if you do opt for a drink during the holidays, try to keep it to 1 serving. I find that, you know, a lot of times we kind of lose track of what 1 serving might look like. And this slide helps you kind of know how much a serving is depending on the different types of alcohol. And lastly, because 2020, remember to be safe. Wash your hands a bunch. I think hand sanitizer is going to become it has become a household staple. Try to avoid the large gatherings if you can, trying to keep it to, you know, a household. Stay close to home if you can. Really try to stay home if you're sick. But most importantly, I want you to all enjoy the holidays and eat what you like. And that's my health tip.
Fantastic. Well, thank you everyone for joining this quick virtual meet and greet. We are so excited to be in Greeley. It's actually been the #1 requested location for a new Paladina Health office over the past several years. So we're delighted to open our doors. We look forward to meeting you. Please call the clinic or find us on the web portal at my.paladinahealth.com. We have great availability. We look forward to meeting you and your families. And I hope everyone has a wonderful holiday ahead. Thank you.